The Canadian Chiropractic Guideline Initiative mission is to develop, disseminate, and help implement clinical practice guidelines for Canadian chiropractors. We have been fortunate to have support from the majority of stakeholders in Canada, professional organizations, as well as national organizations, in order to develop guidelines on the management of neck pain, as well as on the treatment of low back pain, and it will soon be published. And we also are currently working on a treatment guideline for spinal stenosis, considering the elderly population and the trend in the change in demographics. That is an important topic to address. Curious to know, Greg, why did you want to get involved in the Guideline Initiative? You've been with us for quite some time now, and what was your insight into the usefulness of those guidelines?
Well, there's basically three prongs to this. Firstly, we want to enhance the decision-making of Canadian chiropractors. We know that we can influence their uptake. We look at how engaged they are in looking at the website for CCGI. We know that they're getting their patients to be actively involved in their care. And of course, we have the videos on exercises, and those are going to be enhanced, of course, through the low back guideline, where there's also going to be a yoga component. So you're enriching the knowledge base of the practitioner. We think we'll change or at least influence the decision making, and also we have patient engagement. But there's a third arm to this, which is very critical, and that's actually increasing the credibility of the profession by being more at the table with policymakers and the decision makers in government and other agencies that improve collaboration, firstly, but also look at stakeholder engagement regarding who's at the table for guiding health policy in Canada.
Do you know if other professions are actually using these guidelines?
Well, one thing we do know is that they've been an uptake at the what's called CADTH, which is the Canadian Agency for Drug and Technologies in Health. And so CADTH is a major player in health policy. It is funded by the provincial and federal governments. It's heavily funded. And they use CADTH in order to filter through the evidence and to make recommendations for coverage for Canadians in healthcare. And so we're part of that process. They've evaluated our latest neck pain guideline just over the last year, and they found that our clinical practice guideline, as developed by the CCGI, was of high quality. As a matter of fact, it was all our recommendations were accepted by CADTH, and this helps associations and practitioners and other engaged parties this is a resource for them to look at the credibility of the profession. So it was like a secondary endorsement of our guideline, even though we knew we produced it at a very high quality. Having that external evaluation and brought forward as a resource to governments, we think is very, very critical and very, very important to move the profession ahead. André, there's been a series of guidelines on low back pain over the last number of years, and of course the CCGI is currently awaiting publication of the one we've completed over the last couple of years. Now, what is the importance of this guideline relative to other guidelines that have been made by other organizations, other countries? What are we bringing to the table on the latest CCGI clinical practice guideline in the treatment of low back pain?
Well, let me first highlight that indeed since the mid-'80s, there were a number of guidelines that have been published, and over time there's an interesting trend or evolution on the recommendations that have been produced and released. The recommendations that will soon be issued in the low back pain guideline from the CCGI are essentially in line with those of the American College of Physicians guideline, as well as the Danish National Guideline on the management of low back pain. And that is that non-pharmaceutical approach should be provided first. And then, if that doesn't work, patients should be able to consider other approaches, more of usual medical care, including anti-inflammatory medication and painkillers. One of the biggest shifts there's been in treatment of back pain for the last probably 30 or 40 years. And so that's going to require probably rethinking of how we're actually approaching back pain patients, and especially in general practice, where patients will be then offered either physiotherapy, chiropractic, or other avenues, including exercise and self-management.
Now, this will be quite a cultural shift, André. Now, is the healthcare community ready for this sort of change? Because we're not alone in the process here. We have to actually have change from other providers. Can you see barriers of this acceptance that are going to be kind of forestall the progress that is actually is reflected in the evidence and, of course, should be implemented in clinical practice?
It's a good question. I'm not sure if it's necessarily a barrier to the providers themselves in face of the evidence. I think they would be inclined to get patients to try their approaches first, but it does take time to change habits. And I'm thinking that probably we're looking at a few years before most of the healthcare professionals are aware of these new recommendations, and probably an extra few years before they're actually implemented routinely in clinical practice.
Wonderful. And you're not just talking about over-the-counter or non-steroidal. I imagine this involves opioids. This involves the entire spectrum of pain management.
Well, especially opioids. There's this Canadian crisis on opioid as well as in the United States, and we see this in Europe right now. It is so important that some pharmaceutical companies are rethinking or stopping producing opioids because of that. But these recommendations do apply to the more benign, either non-prescribed or prescribed anti-inflammatory medication and painkillers.
Do you believe this will also be implemented in neck pain and low back pain across the entire spectrum of MSK care?
In my view, it's possible that within the next 5 years that the evidence would come to a similar level as it has for in the past when comparing back and neck pain. Neck pain tends to, in the literature, scientific literature, to be a slightly slower in its progress. So it is possible indeed that these recommendations would apply to neck pain and possibly to other musculoskeletal conditions. We will find out over time.
Will there be a change in, for example, gatekeeper status? Is there a chance that chiropractors can actually elevate their position in healthcare management for their patients?
It's going to require national and provincial organizations to be at the table, essentially, of discussions. I don't think it's a question of chiropractic being the forefront alone. I think this is of concern for patients in general, and therefore for conservative management profession or those that offer these type of care to be able to communicate properly the evidence to the stakeholders and decision makers and be able to advocate for the benefit of the patients.
A big part of this program, of course, is the knowledge translation component. I know you're spending a great deal of resources on getting these messages out. How are things coming along as far as website utilization, videos of exercises, et cetera? Is that coming along as expected?
It's quite impressive. We have over 1,000 visits to the website every week, and it's been very sustained for a number of years now since we've launched the website in 2013. We have over 50,000 views of the exercise videos that we've produced for neck pain. The one on low back pain are just about to be released. So there's really a lot of excitement around the different tools that are being produced in order to distill and simplify the messages and get this in the hands of chiropractors as well as other healthcare providers and their patients.
And I understand you change the message depending on the audience throughout this process.
Yes, we do need to adapt the language to the target audience, and that's quite important. So we make great efforts to be able to communicate in a way that makes sense to people that we hope will be interested in listening to us, but also eventually to applying this information in their own lives.
Well, thank you, and thanks on behalf of the profession for leading this guideline initiative, André. Thank you very much.
Well, thank you, Greg.